Hello and welcome to your ASMR dental examination today. How are you doing? Good. It's been a little while since we've seen you, so we are going to perform a very thorough examination of your teeth, your mouth and your gums today. And if necessary, we will also do some cleaning just to make sure that your teeth are in tip-top condition. Alright? Good. I'm going to place a bib around your neck just to make sure if there are any splashes or anything that we aren't ruining your lovely clothes there. And whilst I do, have you been having any issues lately with your teeth, or do you have any concerns about your mouth in general? Okay. So, no toothache? No? That's good. Alright. Is that sitting okay for you there? Yeah. Good. What I'm going to suggest we do for you today is place a little camera at the back of your throat just so you can see exactly what I'm doing and I can talk you through everything that I'm seeing. So it sounds a little bit scary, but it's not at all. It's a fantastic new technology and it's really great for us as dentists because it provides an educational purpose and just shows you the areas of your mouth that you would never normally get to see. So for example, if there are things that you're missing when you're brushing or areas that are quite hard to reach, it's just going to show you what we're seeing. So I'll show you the camera. It's quite small, like that. And that just sits nicely in the back of your throat there. And then I'll remove it again at the end of the exam. How does that sound? Perfect, okay. I will put that one in for you now. So if you would like to just open your mouth wide for me. Good. And stick out your tongue. I'm just going to hold it down a moment. Okay. Good. And I'm going to pop the camera in now. Okay, so that one is sitting nicely in the back of your throat now, and it's just going to take a couple of seconds to begin to work. It will send the signals automatically to your brain so you can see the mouth view. But you can switch at any time back to looking at me. Okay? Good. Right. Let's begin the examination then. I'm going to start having a good look around your mouth. And you are more than welcome to join me. Okay. So let's begin over on this lower left quadrant at the back here, just looking at the teeth and the gums. Okay. So I can see, just moving over to the right, lower right quadrant now, I can see we do have some build-up there of dirt and debris. Just a few areas where you're missing when you're brushing. That's quite normal, so don't worry. And let's move up to the upper right quadrant now. Okay, just having a look along the teeth and the back of these front teeth here. Okay. And the upper left quadrant. There we are. Wonderful, okay. So I will give them a clean for you today just to remove those areas where there is some build-up. and I'm going to start now by counting them. Let's see what we have, whether your wisdom teeth are in. So in the lower left quadrant we have 8, 7, 6, 5, 4, 3, 2 and 1. And moving on again to the lower right quadrant, we have 1, 2, 3, 4 is present, 5, 6, 7 and 8. And the upper right quadrant now we have 8, 7, 6, 5, 4, 3, 2 and 1. And on the upper left quadrant we have 1, 2, 3, 4, 5, 6, 7 and 8 all present. So all of your wisdom teeth are indeed there. Did you have any pain when they were growing through? No? Well, you're very lucky because they do cause quite a lot of trouble for some people. Okay. I'm going to look more closely now at the individual condition of each tooth and the surrounding gum. Okay. Good. If you feel any discomfort at any time or you need me to stop, just let me know and I will take a closer look at the situation. Alright. Good, here we go then. So starting in this bottom left quadrant again, just looking at the molars. Any sensitivity on this one at all? No. Okay, and how about this one? Okay, let's have a look. We do have a build-up of plaque around the base of this one, so you would benefit from some plaque removal here. And the next. Moving forward again. Okay, looking at your lower left canine now. Okay. And the lower front canine on the right hand side. And back to the molars now as well. Can you see here there are just some areas like there is what looks like a seed just stuck in the tooth there. So things like flossing are really helpful for that, because sometimes the toothbrush can't quite get in between the teeth in those spaces where food can become trapped, but not to worry, as I will show you some good flossing techniques. Okay. And let's just have a look at these molars slightly further back. Do you have any sensitivity in this one at all? If I just tap on it like this, how does that feel? No issue there? Okay. How about like that? Okay, and what about here and towards the gum? Okay, I'm just going to keep my eye on that one. And let's check the very back one now, your wisdom tooth. Overall, it's looking relatively good down there. I will move up to the top quadrant now on the right hand side and just have a look at those molars as well. Let's see what's going on here. Looks as though you're actually doing a very good job of brushing in this area. Are you right-handed or are you left-handed? You are, I thought so. Okay. Okay. Just checking each tooth as thoroughly as possible. And now let's move on to these front teeth. Backs now. And onto the left canine at the top. Okay. And your molars. Okay, I'm just going to tap them again. How does that feel? Any sensitivity there? Okay. And this one. Good. And your wisdom tooth. All good? No discomfort? That's great, okay. Okay, we're Would you like to take a break for a moment? Just close your mouth for me, that's fine. It can get quite uncomfortable, can't it, having to keep your jaw open for a long time. That's it. If you need to take any breaks at any point, that's more than okay with me. Just let me know. You can always just raise your hand. Okay. You're doing really well so far. So I'm going to have a look at your gums now, the gum health. I'm just going to press along your gum line at the base of each tooth. We're just looking to see really how the gums respond, whether there's any bleeding or anything like that. Do you find that your gums ever bleed when you're brushing your teeth? Sometimes. Okay. And is that all over, or is there a particular area of your mouth where you have trouble? Different places. Okay. Well, let's have a look. So just pressing into those gums, just very, very gently at the base of each tooth to see how the gums respond. Okay. Good. You're doing a great job. Let's take a quick break for a moment. I'm now going to do the front of each tooth. Just here. How's that one there? So there's a bit of bleeding here. Is that sore? Okay. Let's move on forward then. These. How's that feeling? Okay. You happy for me to continue? Okay. Just checking the front bottom teeth now. Along the gum line there. Very, very good. Okay. And let's have a look at the upper. Good. Okay. It's looking good so far. That's great. And around again to the front outer edge of the gum. Okay. I'm just going to hold your cheek across here so I can get to the back. That's it. Okay. Starting on the upper left side. Okay. Working our way around to the front teeth and across to the upper right side. I'll just move your cheek over here as well. Okay. Well done. That can be quite uncomfortable. There are a couple of areas where you are bleeding, which just suggests that there is a little bit of a build-up of bacteria underneath the gum line in those areas. So very early stages of gum disease sometimes to see bleeding when you're brushing your teeth. So it's important for us today just to get on top of that. I'll show you the best way to floss. Do you floss your teeth at the moment at all? No? Okay. Well, that's It's absolutely fine. I know it's quite difficult to do, but I'll show you the best techniques for it and then see how you get on with it. Probably within a week or so, you'll find that the bleeding really starts to improve. We can also suggest some mouthwashes for you that are really going to help with that as well, okay? Lovely. Alright, let's move on then to beginning to clean your teeth. So I'm going to start firstly just by scraping them. Try to scrape some of that plaque away. So I have a little tool that I will just show you. It's nothing scary, just a little head like that. And it's just going to help me to scrape the plaque off of those teeth. Okay? Good. Here we go then. I also just have a smaller scraper. It's got a very tiny little head on it, so that's going to help me to really work into those more intricate areas, okay? So we just dislodged that little seed or something there, so I'll just remove that for you. You can rinse your mouth in a moment, don't worry. Okay, you happy for me to continue? Good. we can clear away what we've been doing so far. Okay, here we go. There you go. And you are also welcome to a little mouth rinse as well, if you would like one. So I'll just pop this down to the side of you here while I prepare the cleaning equipment for the next part, okay? How are you brushing your teeth at the moment? Do you brush them once a day, twice a day? Most often twice a day. Okay. And are you using a manual toothbrush or an electric toothbrush? Manual. Okay. Absolutely fine. Some people don't get on with electric toothbrushes. You can do a perfectly good job with a manual. We do recommend electric, but it's entirely at your discretion as long as you are brushing well with the manual. So I'm going to use a manual toothbrush now then, just to show you some techniques, and hopefully that will help to improve the brushing. There are some areas in your mouth where it's really good, and other areas where you're missing slightly, okay? So if we have a look inside your mouth quickly, this upper right quadrant here is very, very good. The brushing is really good. Inside the teeth as well, I can see that you're doing a really good job. And the same on the exterior of the teeth. You can see these for yourself in the mirror when you look. But as we move further forward to the backs of the front teeth here, you can see that there are some areas that you are missing. And the same on this upper left-hand quadrant. It is quite clean, but not as clean as on the right-hand side there. Although the outer teeth do look also very good. Okay, so when we are brushing, if I start with these back teeth here, we want to be focusing on the gum line as much as the teeth. We are brushing in a circular motion at a 45-degree angle to the gum. And slowly working your way around the mouth. And when it comes to the front teeth, you can just angle the toothbrush slightly like this, so that you can get into the backs of those teeth, like so. process on the front of the teeth at that 45-degree angle. Do you need to take a break for a moment, or are you okay? Good. Alright, I'll carry on. Okay, very good. So you don't need to press too hard with a toothbrush. You don't want to inflame the gums or make them sore. You can brush quite gently. It's just making sure that the surface of the teeth are nice and clean and the gum line is clean as well. However, brushing is only really going to get to about half of the area of the mouth you actually want to clean any brush. So a lot of the bacteria resides in between the teeth and under the gum line. So we really need to remove that by flossing. And I don't know if you can see, but there is a piece of spinach or something just stuck in between this tooth here. So I will show you with flossing how we can remove that. Okay. So I would suggest a satin tape as a floss. And this is a kind of thicker floss than a string, so it can be a little bit easier to work with. All you're going to do is pull a nice long length of it. Like that. And tear it off. You are going to wrap it around your two index fingers and then work it in between the teeth and up and under the gum line. So I will demonstrate for you on the centre front teeth here. See how we just work it in and up, like so, up and under the gum line, and the same along the next one, up and into the gums, and work our way around the mouth. You can see how it removes any extra dirt that was stuck in between the teeth. if you could open your mouth nice and wide for me. Very good. Let's have a look there. Good. Okay, so that is looking much better already. What we can also do, as well as flossing, is we can use interdental brushes. So they look a little bit like this or this. They come in different sizes because your teeth have different sized gaps between them. Some might be too tight to do this, so it's important to never force it, but this is a very small 4.5mm diameter brush, and this one is slightly bigger at 5, so that will be better for bigger cups. So all we do with these is just work them into the gaps in between your teeth. 1 or 2 brushes, and then you're done and you can move on to the next tooth, okay? Okay, so I'm just going to do that for you. You ready? Here we go. Does that feel alright? It's not painful or anything? Good. I'll just finish around this last corner here, bottom right corner of your mouth. So that's kind of a sensation that you have to get used to. Again, it can take perhaps a week or so just for your mouth to really acclimatise to the sensation and for your gums to repair, but as the bacteria is removed, it will begin to settle down and you will notice a significant improvement in the health of your gums. Okay? Good, there we go. If you'd like to have a little rinse, just to wash away some of that debris there. Let's have a quick look inside your mouth again and see what's going on now. Okay, so it's looking much cleaner in here already, isn't it? just going to show you the electric toothbrush as well as an option. With these you're going to brush slightly differently. If you do decide to use them, they can do a quite thorough job. So I will show you quickly how this works. You're basically, rather than brushing in a circular motion, you're just going to hold the brush on each tooth just for a second or two and move on to the next one. Very slight movements, you don't need to actually brush, okay? Alright, here we go. Perfect. So the last thing we need to do before we move on to the final checks is just apply some fluoride to your teeth. It's just going to help to protect them. So I have some fluoride here. It's just a little paste. You can eat and drink as normal after this, that's absolutely fine. Okay, here we go. So just going to paint this onto your teeth with a little brush here. Okay, so here we go. Okay, wonderful. I'm just going to have one final look inside your mouth. gums are not too inflamed, and I can't see any signs of dental cavities or decay that I'm worried about. This back tooth that I was looking at earlier, once it's been cleaned, is actually looking much, much better, so that's really good. Over here you can see that the brushing and the flossing especially has removed a lot of the debris. You actually have very good spacing between each of your teeth and not too overcrowded or anything, so that's going to make it much, much easier for you for flossing and using those interdental brushes. Okay, see these top ones here, I'm just having a feel of the gums as I go, just to see what's going on there, but that's all feeling really good to me. Just having a check to make sure that none of your teeth are feeling loose or wobbly. That's a really good sign. Okay. And again, these are all lovely and straight and very well spaced. There's no overcrowding, and you can see there are also no signs of dental cavities at the moment, so we really want to keep on top of that and keep your teeth in tip-top condition if we can, okay? Good. Right, you can close your mouth for me now. That's the examination part of the inside of your mouth over. I'll remove the camera for you momentarily, but the final thing I need to do is just check your face, your jaw, the outside edges. So if you would like to just sit nice and still for me and relax your jaw down. Good. I'm just going to check along your jawline here. Just feeling the lymph nodes, and while my hands are there, if you could just open your mouth nice and wide for me. Very, very good, and then just close it tight. Okay, and I'm just going to feel your bite there while it's tightly closed. Okay, that feels good. And if you could open your mouth nice and wide for me again. Good, that's really good. And just stick out your tongue for me. That's it. And back into your mouth with your tongue. And lift your tongue up to the roof of your mouth. That's really good. Well done. Okay. That's all feeling perfectly normal. So I'm just going to remove the camera from the back of your throat there with my tweezers. So if you'd like to open nice and wide for me again a moment. Okay, very, very good. And I'm just going to reach in there to the back of your throat. And just remove the camera for you. Like so. Okay. You have done an absolutely wonderful job today. I hope it wasn't too uncomfortable for you. Good. Okay. I'll update the system with some notes about the checkup today, and I'll have reception prepare you the mouthwash that we'd recommend just to help those gums heal.